very. Someone said you're looking beautiful today. I'm like, can I use a word beautiful for a man? Okay, but of course he looks very pretty and very handsome. Right. So he's a professor of epidemiology. I love this word very, very well, and I'm happy that I'm able to pronounce it. I found it very difficult to pronounce before, but today I've been able to pronounce it very well. So he's a professor of epidemiology and public health at the University of Cape Coast. He's a director of the Directorate of Research, Innovation and Consultancy at the University of Cape Coast again. He's a project lead as far as this project is concerned. In fact, this project, it is let me say his baby. I mean, he holds it in his arm. So, with a round of applause, assist me to welcome Professor David Teidoku to take the stage. Thank you very much.
Okay. Thank you very much, distinguished invited guest. I want to stand on the protocol already established to welcome all of you warmly to this very important event. I'm going to give, as they said, a brief background to this HH, as we call it, HHSDG think tank. We've had a lot of discussions about what really is this think tank. In fact, when we invited one of the UN organizations to join us to nominate a rep to be on the think tank, they first got back to us that they don't engage in think tank activities. They are supposed to be independent and non-partisan and just support government. But when we explained what we mean by this think tank, they saw it's a think tank like no other think tank. And so I'm going to share a brief background, this to you. So we all been working with the SDG for some time now, since 2015 when the MDGs gave way. But there are a lot of challenges. There are a lot of challenges. I don't normally like when the slide changer is not looking at me or it's not giving me the power to change. So please watch me. We are working as collaborators globally to see how we can whip up interest and accelerate progress towards the attainment of the SDGs. First phase of this project took place from 2018 to 2020. And the idea was to assess progress towards the health and health-related SDGs. And through that, we learned certain lessons which motivated the need to do what we are doing now, and I'm going to share. So at present, it seems from that review and that project that many countries are not on target to meeting especially the health and health-related SDG. Advancement has been hampered, especially by mounting risk associated with population growth, urbanization, and the COVID, which is a blessing and a curse also, a curse and a blessing in disguise. And of course, gender issues, economic and socioeconomic inequalities have all contributed to throwing a challenge as to how countries can work on that. And last but not the least is the issue about climate change. Climate change affects all of these issues, and I'm going to share some thought on that. So climate change in particular threatens to jeopardize the improvement in healthcare globally, and climate change-related disruption of important systems like food supply system have worsened issues about nutrition and health outcomes. Next. So we are seeing some work that has been done in this respect. And through this work, we are leveraging on looking at what we can do together with all stakeholders across the entire ecosystem from civil society, academia, development partners, governmental organizations, and all of that. With particular focus is the impact of climate change on health, both direct and indirect. Please, can you show the slide on climate change? Impact of climate change, both. No. Next, yes. So climate change has really contributed so much in this pathway, the ecosystem, and has affected actually every angle of what we do. The direct effects are clear. Yesterday, when I was driving to set up or to work on this meeting, I called a friend and I said, well, what I've been seeing on TV, you see it. I'm seeing it now. I was driving in the then the team coming from Cape Coast, they got water into their bus when driving here in the morning. So things about storm, drought, flood are common sight that we see all over, heat waves and all that. Then that is leading to indirect issues like water quality, air pollution, land use changes. Where we used to farm, when you go to the villages, there are no arable lands to farm. If there are, they are dry. You can't do anything about it. Then ecological changes are also taking place. And then this in turn influence social issues like health status, of course, socioeconomic status, social capital, public health infrastructure are also not in the best place, especially in our parts of the world. And of course, all of these put together impacts our health. Mental health, when you are out of your house and you hear your house is flooded, the first thing is in your mind, how do you survive? How do you make it? How are you able to cope with it? So mental health issues, other nutrition issues, allergies, cardiovascular diseases, infectious, outbreak of infectious diseases and all that are now with us because of climate change. So climate change has become a very central theme when we are looking at the broad frame of health and health-related SDGs. Next slide, please. So what are we addressing actually? Next. We have created a consortium known as CHOICE. CHOICE is an acronym for Consortia to Address Climate Change, Health, and Complex Challenges. So this is a CHOICE project, and under that we are looking at health and health-related sustainable development goals. The project entails coordinating a multi-country initiative to support and implement the implementation of health and health-related SDGs across several countries. Next. Specifically, we are aiming at creating active in-country, and this is very important, active in-country multi-sectorial think tanks to facilitate work towards achieving the health and health-related SDGs. We aim to conduct in-depth country analysis, case studies, and develop and support local cross-cutting solutions to contextualize barriers through focused research, analysis, and advocacy towards improving health, nutrition, and the food system, in fact, the entire ecosystem. We aim to support inclusive and transparent governance processes for the oversight and monitoring of the health and health-related SDGs. We aim to advocate for progress towards the health and health-related SDGs with government and civil society stakeholders like all of us in this room. We aim also to monitor and evaluate progress to achieve the health and health-related SDG and accelerate strategies to address climate change and adapt to its consequences. We are working with global partners in this regard. Second, we aim to create global consortia for accelerated learning, monitoring, and advocacy for improved implementation of the SDG targets and reducing inequality. Some progress have been made, but they are unequally distributed, and we aim to do that. So this consortium is made up of 6 countries. 5 are listed here. The invisible one, I'll tell you. Pakistan, Ghana, Kenya, Tanzania, Kyrgyzstan, and the invisible one is Canada. And if our system works, the global Canadian partner who is representing the government of Canada, or the High Commissioner here, will be joining us to share some remarks on that. So we are working with these partners to do all of what I have mentioned, to ensure that we bring stakeholders together to support government in whichever way we can, science, policy, learning and sharing, translating the learning to communities, working with communities to be able to do this. We want to assemble technical advisory group. Last year we met in Dubai to work together with them from all of these 6 countries who are advising and supporting what the individual countries are doing. We want to conduct rapid, systematic review, hardcore evidence that would inform policy direction and where we need to make changes. Next. We are also aiming to undertake, mentioned already, rapid review to look at the status of implementation in each of these countries. Not only at the country level, the national level, but we are aiming to look at the subnational level. How are the gains, or where are the gaps, and how are they trickling down there? And I'm here, I'm happy that GSS is here, Ghana Statistical Service Rep is here. We're looking at whether we can have data at the disaggregated level, at the sub-national level, to be able to see, even if you are making some gains, how are these gains being shared across the country? And then, in all of this, we aim to establish in-country think tank, which is like no other think tank. A think tank that is supporting government, that is supporting stakeholders to drive this process. So do country case study, develop think tank in these countries. We have done that already in the 5 countries that are running now. We're supposed to give in-depth cases studies to develop solutions. We're supposed to be focused, placed on reducing inequality is very key to our work. And above all, we're looking at providing hardcore evidence that will support the government in its drive to improve health. Next. We have a framework we're looking at, as the chair of the event has said. The SDGs, 17 of them, are all interrelated. So we are not focusing only on the health, which is goal 3, but we are looking at all the others that are related to the health, whether directly or indirectly. So there are a number of them, and there are interconnections. We are studying and how we can improve them. And of course, I mentioned about the central issue, which is climate change. Climate change, gender, mental health. We're looking at how all of this will play together. A lot of work has been done already in this area, and we are not going to reinvent the wheel. Our aim is to ensure that we are contributing to new knowledge in this area. This is the dashboard that is not very clear about Kenya, and in Ghana, dashboard on the SDGs, sdgindex.org. The issues have been done there. What we are interested in is how is it within the subnational level, what are the gaps, and how we can whip up interest in promoting this across. These are also already issues that have been done. This is for China. And you see, they are looking at the subnational levels and how the gains that they have made is being distributed across the board. We should be able to see these kind of issues also in our country and see how it can inform the intervention that we do. So we have a national, or if you like, the Ghana HHSDG think tank, which is made up of members from across the entire stakeholder groups. So we have the National Development Planning Commission represented here. We have the Gender Department, Ministry of Gender, Children and Social Protection. We have coalition of NGOs in health, represented by a member, Vision for Alternative Development. We have also reps from CSO for SDG platform. We have Ghana Monitoring and Evaluation Forum. We have Green Africa Youth Organization. We have Basic Needs Ghana. Ghana National Council on Persons with Disability. They are represented also in this room and they are part of the think tank. We have also reps from academia, University of Cape Coast, University of Ghana, Kwame Nkrumah, University of Science and Technology, University for Development Studies, and our development partners are also equally represented here. UNDP, standing for the UN organizations. Okay. Come on. Next slide, please. Right. Okay, so the choice event, the choice program is being coordinated by the University of Cape Coast as a partner with the global partners, and all of these institutions that I've mentioned are part of us. Myself and 3 of my colleagues here are coordinating that. Professor Frederick Atuama, which we are happy, is also now the director of program for the Association of African Universities. So we have over 400 universities within the Association of African University, and he's there. So he brings all the expertise and all the eyes, that all the things he has seen across these 400 institutions to here. Unfortunately, he's unable to be with us because he's traveled abroad on another assignment, but he's joining us online. We have Professor Fifi Amako Johnson here, a climate statistician, and then Dr. George J, who is an epidemiologist and biostatistician with expertise in systematic review, and many of my colleagues seated here who are supporting this. I give some conclusions now. Given the current situation, it may not be possible to achieve the 2023 agenda without accelerated implementation of the HHSDGs. If we move at this pace, it is not possible to achieve many of them. And that is why we need accelerated effort. We need to put our effort together to be able to do that. The integrated implementation of the HHSDGs will need to become central to the development agenda, especially at sub-regional levels, and not be seen as additional or external or vertical initiative. We need to do that. And I would emphasize that, yes, we need the collaboration of development partners, but we also need to take local initiative, governmental and sub-governmental, non-governmental levels. Given the need for adequate finances, and it has been mentioned here, an extra demand for universal health care, innovative financing strategies. The chair, I'm happy, he has not seen my note, but he has mentioned that innovative financing strategies will be needed to mobilize domestic resources. The emphasis is on domestic resources, earmarked for sustainable gains in the HHSDG. I'm happy we have an honorable guest, keynote speaker from the office of the president, and in charge of Dr. Eugene here, in charge of HHSDGs, to also share with us how we can do this. And then after break, we'll be having the panel discussions where we can really share our thoughts, how we can move this process forward. Engagement with development partners will be needed for financial and technical assistance. Yes, with domestic resources are key but also engagement with development partners is very key to support us financially and also support us with technical assistance. But national government should lead the cause. We should lead. Very important. Then monitoring, evaluation, accountability is very key, and it should be strengthened and linked to measuring impact and equity indicators. All of this could be facilitated by national and regional think tanks, and that is what we stand for, and hoping that all of us will join our hands together to do this. We have some partners that I would like to acknowledge: the Aga Foundation in Canada, the IDRC, CRDI, Sick Kids Canada, and the Aga Khan University have supported that with resources. All of what we are doing now is coming from the resources they've given. We're hoping that with time we'll be able to mobilize local resources to continue with this. Thank you very much for your attention.
Are we tired already? Please, can we give it up for him? Indeed, I must say that that's one of the reasons why we are here. So if we've had a better understanding of why we are here, at least it's important that we acknowledge that and do it very well. So thank you very much, Professor Doku, for giving us this wonderful speech. Indeed, I will repeat again. But let me ask a question. So are we on track in achieving the SDGs and the health and health-related SDGs? This is not a question for you to respond to. I know our next speaker is well versed in this, and then obviously he will give us a hint on whether, as a country, we are on track, because we are hearing at the global level that the whole world is off track in achieving the SDGs. But before you know, maybe Ghana is on track. So we definitely will hear from him when he mounts the podium. But before I proceed, I'm happy that one of the main areas that Prof mentioned has to do with climate change. In that, for me, is an interesting area, and I'm happy that at least many researchers in the country also are taking a lot of interest in this space. I know, most of the universities are beginning to up their research, especially on the health-related aspect of, climate change. Indeed, let me say that aspect has been ignored for a long time, until recently, and I'm saying this for a fact, because until recently, the UNFCCC Conference of Parties that take place every year, I'm told this is the 29th of its kind. Until recent, 25th, I'm told, right? Correct me if I'm wrong. Indeed, we were not seeing much of health-related matters at the conferences until recently. So I'm happy that at least we are making strides. But even in Ghana, I'm not sure if you have somebody from EPA or from MESTI here. But if they are here, and if they are not here, I think the Ministry of Health is here. There's a need for that multi-sectorial, approach to doing things. Because I feel that when it comes to issue of climate change, it's a bit missing. Because per my checks, the Ministry of Health, I don't know if they have a desk office on climate change. Maybe the minister's rep will tell us if they have a desk on climate change at the Ministry of Health. Because indeed, you can't talk about health, and living, climate change, at the back burner. So we need to have that kind of collaboration if we want to achieve the SDG Goal 19, Partnership for Development. So thank you very much, Prof, for highlighting that. And indeed, he also mentioned mental health, which of course is a cross-cutting issue, even beyond the health and health-related SDGs. On that note, I have the singular honor to introduce you a man that I loved. I say loved because we lost touch for many, many, many years. Today when he saw me, he said, I have neglected and rejected him. because he's an old man. I said, no, you're not an old man. You're still very strong and very fresh. So he is, of course, I mean, you can't have this meeting concluded without having a person of this nature in our mix. I mean, the presidential advisor on the SDGs in Ghana. He is Dr. Eugene Owusu, and I said he's a special advisor on the SDGs at the presidency. Prior to his role, or this role, from 2015 to 2017, Dr. Eugene was Deputy Special Representative of the UN Secretary General in South Sudan, where he concurrently served as the UN Resident Coordinator, UN Humanitarian Coordinator, and UNDP Resident Representative. Before his assignment in the South Sudan, Dr. Eugene was the UN Resident Coordinator. And pardon me, yes, UN Resident Coordinator, UN Humanitarian Coordinator, and then also United Nations UNDP Resident Representative in Ethiopia from 2010 to 2015. Prior to that, Dr. Eugene was a senior advisor in the UN CUM, United Nations Development Program, in the Brussels office, facilitating instrumental institutional partnership on Africa with the European Union on behalf of UNDP Africa. After joining UNDP in 2006, I don't know if some of us were born then, and in 2006, in 1996, Dr. Eugene worked in several capacities in the African region, including as economic advisor in the UNDP Uganda and the UNDP Sierra Leone, as well as the Deputy Resident Representative in Tanzania. Again, prior to joining the UNDP, he worked in the private sector in the United Kingdom, all the way in London, including notably as the senior country risk analyst and head of economic research at, I don't know whether I'll get this in Dun or Dan. It's D-U-N. I don't know how you want to pronounce it. And Brat Street in the United Kingdom. Please, with a wholesome round of applause, let's welcome Dr. Eugene Owusu, the Special Advisor to the President on the Sustainable Development Goals. You had the floor.
Thank you so much, my good friend. I warned you against a very long introduction, and you insisted on doing it. You see why you struggled? The chairperson of this august occasion, who happens to be the representative of the UN Resident Coordinator, the representative of the Canadian government, who I understand is joining us virtually, the convener of the National SDGs Stakeholder Engagement, friends from the media, distinguished guests, ladies and gentlemen. I deem it a great honor to have the opportunity to speak at the seminal National Stakeholders Engagement on the health and health-related sustainable development goals and the inauguration of a national SDGs think tank. I thank the organizers for the opportunity provided for the SDGs Advisory Unit in the Office of the President to contribute to today's dialogue. Friends, this stakeholder meeting comes at a pivotal moment as our world prepares for the Summit of the Future, which aims to turbocharge actions on the SDGs, as well as to build a consensus on delivering a better today while safeguarding the future. As we've heard earlier this morning, the SDGs are indeed interconnected. Action in one area affects outcomes in others. Health is central to this agenda, not only as a crucial but also as a means to achieving other SDG goals. SDG Goal 3 is paramount because health and well-being are foundational to human progress. Good health, as all of us do know, reduces healthcare costs. Good health improves quality of life. Good health enhances labor productivity, thereby contributing to economic growth and development. We also do know, friends, that health-related issues intersect with various SDGs, as we heard this morning, including the goal on poverty, the goal on hunger, the goal on education, the goal on gender equality, the goal on clean water and sanitation, and indeed the goal on economic inequality. Ladies and gentlemen, globally, health outcomes have significantly improved over the past 2 decades, as seen in the sharp decline in the global maternal mortality ratio. And childhood mortality rates have more than halved since 1990, according to WHO statistics, primarily due to improved immunization, better nutrition, and effective interventions against diseases like diarrhea, pneumonia, and malaria. Ghana, our beloved country, has also made good progress in the health and health-related SDGs. For example, the National Health Insurance Scheme has significantly increased access to healthcare services and enabled many, many Guineans, particularly the poor and vulnerable, to seek medical care when needed. Additionally, the evidence shows that immunization rates in Ghana have seen substantial improvements, bolstered by robust vaccination campaigns and effective public health messaging. The community-based health planning and services initiative has been instrumental in bringing healthcare closer to our communities. And the introduction of drone technology for the delivery of medical supplies has been a game changer in our country. Since its launch, as I believe many of you here do know, in 2019, the Zipline drone delivery service has transformed the logistics of medical supply distribution, particularly in remote and hard-to-reach areas. Despite these achievements, though, significant challenges remain, and we've heard some of those challenges this morning. The COVID-19 pandemic exposed vulnerabilities in our health systems, it strained our resources, and it exacerbated existing health disparities. Malnutrition, food insecurity, and the rising burden of non-communicable diseases continue to undermine our progress. And infrastructural and funding gaps, as well as inequities and inequalities in access to healthcare, particularly in rural areas, are undermining our efforts to provide universal health coverage. Friends, ladies and gentlemen, to overcome these challenges and accelerate progress towards SDG Goal 3, we must strengthen, as a matter of priority, our collaboration and harness the strengths and assets of all stakeholders. We must do so as a matter of priority in 5 key areas as follows. First, and I'm glad this subject has been touched on by many of the speakers who preceded me. First is mobilizing finance and investments. We do say that in every enterprise, where the rubber hits the road is in financing, and this applies to the HH SDGs. So first, achieving SDG Goal 3 requires substantial financial resources and strategic investments. To bridge the financing gap, we must be deliberate in increasing health spending and in deepening private sector participation in the sector. We should be aggressive in pursuing our quest for increasing health spending to align with the global average of at least 10% of our gross domestic product. This increase, I do believe, can be achieved through efficient budget allocation, through prioritizing health in our National Development Plan, and enhancing tax revenues dedicated to health services. Unlocking innovative and sustainable financing also requires strong partnerships with the private sector, which generates the wealth essential for our economic and social investments. The private sector, as we all do know, drives the innovation we need to accelerate progress, and we must fully leverage, to this effect, we must fully leverage our PPP policies to deliver the requisite infrastructural projects and services. Second, very quickly, is the role of emerging technologies and innovation. In our quest to achieve SDG Goal 3, leveraging emerging technologies and smart innovations present a unique and transformative opportunity for us. Technology can bridge gaps, they can enhance efficiency, and they bring healthcare services closer to the people who need them the most. The following key areas where technology is already making a significant impact and where further innovations can drive us towards our goal bear mention. And I'll just run through this very quickly. A is digital health records and telemedicine. Digital health records and telemedicine have revolutionized healthcare delivery worldwide. In our country, we have begun to see the benefits of these technologies. Digital health records streamline patient data management, they reduce errors, and they ensure continuity of care. And as regards telemedicine, as all of us do know, is helping to bridge the geographical divide between healthcare providers and patients. During the COVID-19 pandemic, telemedicine became a lifeline, enabling consultations and follow-ups whilst minimizing the risk of virus transmission. I'd also like to mention quickly as B, innovative supply chain solutions. One of the most exciting achievements in our country has been the use of drone technology to deliver medical supplies. These drones, as all of us do know, deliver blood, vaccines, and essential medicines to remote areas, ensuring timely access to critical supplies. What we now need really is scalability of this intervention. 3, or C, artificial intelligence and big data. You can't run away from artificial intelligence in our world today. Artificial intelligence and big data analytics offer tremendous potential for transforming healthcare in our country. AI can assist in diagnosing diseases, as we do know, predicting outbreaks, and personalizing treatment plans. And big data analytics, meanwhile, can identify health trends and optimize resource allocation. And D, finally, is enhancing health education and awareness. And here again, I'm glad this was touched upon. Emerging technologies are also crucial in health education and awareness. Virtual reality and augmented reality can be used to train healthcare workers, providing immersive and interactive learning experiences. Social media platforms that all of us have become accustomed to, social media platforms and online campaigns can disseminate health information quickly and widely reaching a broad audience. Leveraging emerging technologies and smart innovation, therefore, in my view, is not an option. It is a necessity for accelerating the achievement of SDGs in Ghana. We must be bold in our ambitions and embrace these technologies as they are so crucial to prospects for achieving SDG Goal 3. My fourth broad point, which is my penultimate point, is active community engagement. And again, this has been touched on earlier. Our collective journey towards achieving SDG Goal 3 is deeply intertwined with the active participation and empowerment of our local communities. We all do know that when communities are involved in the design, implementation, and evaluation of health programs, the impact is profound and is indeed lasting. As a country, we have made good strides in community health through initiatives like the community-based health planning and services, bringing healthcare closer to rural and underserved populations. A Poagnite example is the role of community health workers during the COVID-19 pandemic. We must, all of us, must work together to consolidate these gains through education, through building sustainable partnerships, and through fostering community ownership and accountability. My final point in terms of recommendations going forward is the absolute need for increased attention to NCDs. In the last few decades, NCDs have gained recognition as a significant cause for morbidity and mortality in our country. While there is limited population-based data, available evidence suggests a surge in the burden of NCDs in the country and the associated risk factors. This situation calls for concerted response through robust policy formulation and implementation and deliberate strategic interventions. In addition, promoting healthy lifestyles and preventive care can significantly reduce the burden of NCDs. Public health campaigns on nutrition, physical activity, and mental awareness become most crucial. Friends, as I conclude, let me state emphatically that health is the cornerstone of sustainable development. As we strive towards the ambitious targets of the SDGs, we must recognize that good health underpins all other goals. Without a healthy population, efforts in education, efforts towards economic growth, and efforts towards poverty alleviation cannot be fully realized. Thus, accelerating progress towards SDG Goal 3 is not just a health priority for me. It is an absolute development imperative. Our development strategy, therefore, must reflect this interconnectedness. Let me use this opportunity to congratulate the vision underpinning the HHSDGs and the think tank, I should say, and also really congratulate the champions of this fantastic initiative. Together, with a renewed commitment and a stronger collaborative spirit, we can overcome the challenges and build a healthier and a more prosperous country. Let us use this platform, friends, to share knowledge, to forge strong strategic partnerships, and to catalyze actions that will enhance prospects for achieving SDG Goal 3 and indeed for achieving the 2030 agenda more broadly. I thank you so much for your attention. Thank you.
Wow. Please, can we give up for him again? Indeed, you know, when I was reading his biography, as he gave me a short bio, but Prof, Doc, sorry for taking a long time to introduce it, because we need to know indeed who is standing before us, so at least we can properly give him all the listening ears. In fact, he has given us everything that I think we need to know as far as you know, the presidency is concerned with respect to the SDGs. I also have some few that I know. Indeed, I don't want to belabor the point, but let me just leave it like that. But let me just mention that, indeed, Prof, you've mentioned some key and critical issues that, for me, I mean, as the program was going, I truly wanted it to be mentioned. One key thing has to do with the NCD risk factors. I mean, the fact that it's a growing, issue. At the World Health Assembly, many of the side events, many of them, I could count about 65% of the events were on non-communicable diseases. It's one of the growing, burden of diseases as far as, the world is concerned. And Ghana is definitely not an exception. That's why some of us, we are a bit disturbed when interventions that will reduce the NCD risk factors are not gaining so much grounds. But of course, thank you for highlighting that, and of course also mentioning the fact that we need to be more active in terms of physical activities, which is one of the major risk factors for the NCDs. Tobacco, alcohol, unhealthy diet, air pollution, and then also mental health and air pollution, then physical inactivity is very critical if we want to achieve the SDGs. In fact, there are many low-cost things that we can do, to support our own selves and also to reduce the burden, especially amongst our children who are coming up. That is why I won't leave this stage, by not mentioning the fact that we just commemorated World No Tobacco Day, which was held on Friday. And indeed, it's indeed a reflection that we need a lot more to do to protect our children from the new and emerging, tobacco and nicotine, flavoring, vapes, and electronic products. These are things that we can easily do to protect our children if we want to achieve the SDGs. So thank you very much, Prof, once again. Before I move to the next item, I would like to invite one of our own, to shake us a bit, because physical activity is one of the things that we need to, be doing. That's why in many of our meetings, we like to, invite at least somebody to give us some little, shake up. It helps to walk the talk. And let me use the opportunity to commend our Director General for the WHO, Tedros, who has since taken office, has made physical activity one of his baby. And anytime there's an event, especially at the UN, he makes sure that he organizes a walk the talk, so at least people could have a feel. And he encouraged that we should also replicate this in our countries. I would like to call on the Ministry of Health to at least also dedicate at least, if not the whole, month, at least one day for physical activity, national physical activity, so that we can begin to walk the talk and then emulate what our WHO Director General is doing. So on this note, I'll call Mr. Mpoma again to give us some little 2 minutes, 1 minute physical activity, as we proceed with the event. Thank you very much. Mr. Mpoma, you have the floor.
All right, thank you, Labram. Let's give it to Labram for making the exercise very active. WHO says health is a state of complete physical, mental, and social well-being, and not just merely the absence of disease. And so this tells us that then we sitting here, we are all sick, oh? And so we'll do some small exercise, and it goes this way. All right, so as you sit, there's a way we can do an exercise while sitting. So we have two postures that we are going to position. So we'll be doing 2 exercises. So when I say sit up, you do as I say. And so sit up, you sit straight, with your spine and everything positioned. And we are all going to do it together. So I'm coming to start. Now we are all relaxed. Our spine is having a lot of problem. So sit up. Sit easy. Then you go back to your normal position. So we are going to do it faster and see how the rhythm goes. Sit up. Sit easy. Sit up. Sit easy. All right. This is how the paramilitary put into their system. And the concept is that it's always good to sit straight and to sit well, where your spine will not be having too much problem. The next is we shall stand. And so I learned this joke from a recent meeting I attended. There is somebody who went to hospital and the doctor diagnosed that, please, can you be taking or can you be doing more exercises? And the gentleman said, Doc, can you please prescribe it in a syrup form for me? And so sometimes it is difficult to do an exercise. So we are going to stretch our 2 legs. We'll hit it on the ground as though we are going to clap for all of us. And so it goes this way. 1, 2, 3. 1, 2, 3. Let's go. Again. And the hand. Thank you.
Thank you very much. I'm told clapping is also an exercise, so please let's clap for him. Yes, I'm told clapping is a very good exercise, so please let's encourage clapping as well in our daily endeavors. Right, so thank you very much, Mr. Mpoma, for this short exercise. I think the moment is here. We are going to have the special vote of special remarks. Of special address from the representative of the Minister of Health, Honorable Minister of Health, Dr. Okoboy. This address will be delivered by no other person than Dr. Eric Insia-Boateng. Dr. Eric Insia-Boateng has 20 years experience of working knowledge and understanding of the Ghanaian health system, and over 10 years of experience in health system research and consultancy. At present, Dr. Eric is the head for monitoring and evaluation at the Ministry of Health. Prior to assuming the position, he worked as a senior manager for policy at the Ghana Health Insurance Authority. Dr. Eric served on the National Ambulance Board and a member of the National Level Steering and Advisory Committee. Join me in welcoming Dr. Insia as he takes the stage to deliver the statement from the Honorable Minister for Health.
Okay, good morning to everyone, and I bring you greetings from the Honorable Minister for Health, Honorable Dr. Bernard Okoboy, and then the Chief Director, Alhaji Hafiz Adam. I sent my brother a text message to not make a long introduction, but it appears maybe he did not see that. Because I'm here to represent the Honorable Minister. Before I deliver this note on behalf of the Minister, I think Labram asked a question whether we have a climate change at the Ministry. A desk. We don't have a desk yet, but we have a focal person that also attends the meeting with the EPA and other relevant agencies. So I'll do this on behalf of the Honorable Minister, as I just said, and I would like to stand on all the established protocols. It is my pleasure to join you this morning as a special guest for the National Stakeholders Engagement on Health and Health-Related Sustainable Development Goals and an inauguration of the HHSDGs think tank. First and foremost, permit me to use this opportunity to thank the organizers for putting this meeting together to discuss and agree on collaborative approaches for speeding up our progress towards attainment of SDGs in Ghana. In fact, the theme for this event, which is catalyzing progress, strengthening collaborative approach for health and sustainable goals in Ghana, re-echoes the tenets of the health sector's Common Management Arrangement framework for dialoguing and working together as stakeholders to improve sector performance. Ladies and gentlemen, as you may be aware, the SDGs have engaged the attention of policymakers and stakeholders in health internationally and nationally over the last decade, that is since 2015. In fact, achieving the SDGs is crucial to providing increased access to individual and population-based services and to addressing impoverishment due to catastrophic out-of-pocket payments at our facilities. As stakeholders in the health sector, SDG 3, which aims to ensure healthy lives and promotes well-being for all, at all ages, is our main target. This is not to say that the other ones are not important, as mentioned by other speakers. However, with less than 6 years to 2030, we are behind some of the targets of the Goal 3. And I'll just give 2 of these targets. The first one, SDG 3.1, which mandates member countries of UN to reduce the global maternal mortality ratio to less than 70 per 100,000 live births. And that of 2, to aim at to reduce neonatal mortality to at least as low as 12 per 1,000 live births, and under 5 to at least as low as 25 per 1,000 live births. Mr. Chairman, the last Ghana maternal health survey conducted in 2017 shows a maternal mortality ratio of 310 deaths per 100,000 live births. But if you look at the data from the electronic medical records, we are around 109 deaths per 100,000 live births. The recent Ghana Demographic and Health Survey 2022 also shows neonatal mortality of 17 deaths per 1,000 live births and children under 5 mortality rate of 40 deaths per 1,000 live births. Clearly, these findings indicate that we have a lot to do to achieve the SDG 3 targets, including those related to NCDs, HIV, mental health, and tuberculosis. The good news, however, is that we are making progress towards attainment of these targets, as shown by performance assessment of the sector over the last 5 years, from 2019 to 2023, and also mentioned by the President's advisor on the SDGs. We only need to double our efforts to mobilize the needed resources and expertise to prosecute the various interventions. This task, undoubtedly, will require that we work collaboratively in an integrated manner using the One Health and Health in All approaches with all stakeholders, especially those outside the sector. Mr. Chairman, as a country, we have developed and implemented several interventions to facilitate attainment of SDGs in Ghana. At the policy level, we have developed the National Health Policy 2020, the UAC Roadmap 2020 to 2030, the Health Sector Medium-Term Plan 2022 to 2025, the Essential Health Services Package, the National Health Quality Strategy, among others. At the operational level, we are strengthening the National Health Insurance Scheme through digital interventions to improve enrollment and equity. We are also strengthening the primary healthcare system through improving the availability and accessibility of essential health services. And I would like to say that the World Bank, together with other DPs, are supporting us to implement the network of practice, which is aimed at reorganizing the primary healthcare services at the community level. We are also strengthening the community engagement through community-based health programs and citizens' involvement in healthcare decisions. And we are doing this through the community scorecard. And we are also improving partnerships and collaborations with international organizations, NGOs, and the private sector through what we call the common management arrangements that we have in the health sector. And all these things are meant to improve or facilitate the attainment of SDGs. We'd like to also mention that we are also improving our health information systems to generate and disseminate evidence for timely decision making. Ladies and gentlemen, before I conclude, the ministry recognizes the need for collaboration, partnership, and continued engagements with stakeholders to achieve its vision of a healthy population for national development. Therefore, we welcome this meeting of stakeholders to discuss how to strengthen collaboration for achieving the SDGs in Ghana and the inauguration of the HHSDGs think tank. It is our hope that this meeting will generate actionable collaborative approaches
for achieving the SDGs in Ghana. We also take this opportunity to invite the new think tank to be part of our engagements for improving health outcomes for the population of this country. I thank you all for your attention and wish you a successful deliberation.
Yes, thank you very much. The representative of the Minister for Health, his last request, I don't know whether it's a request or it's a command, but Prof, I think this one goes to you. I mean, and to all of us that they are inviting us, to come formally. So indeed, we need to quickly, write and then formally meet with the appropriate, department at the Ministry of Health, so that we can begin our collaboration effectively with them. Right. Before we go for our healthy snack break, I would like to acknowledge the presence of some few individuals. I'll do that as we proceed. So we are honored, to have in our present Professor Adonu. He's the rector at the College of Physicians and Surgeons. I don't want to go into his biography. He's all in all. So we are privileged to have you in our midst today. Thank you so much, Prof. We also have Madam Belinda representing the UNDP in our mix today. Thank you very much for coming. We have representative from GIMPA also in our mix today, I'm told. Can we have by wave of hand if they are here? Yes, so we can see them at the other end. We also have the Vice Chair of the Ghana NCD Alliance also in our mix here today. He's right here. In fact, he's just coming from Geneva. He also attended the World Health Assembly. Indeed, he told me that he arrived yesterday, and today he's here with us. This shows the commitment that, indeed, he gives to health and health-related matters. So we'll take a quick snack break. When we convene, we'll go straight into a presentation from our partner from Canada, I'm told, right? Yeah, and then also we would have the panel discussion. Then we are off from here. So please join all of us to a tasty, healthy snack break. Thank you so much, and we break for. Yes, please. I've been notified that if we can have a group photo before we go for stuff, please quickly if we can have a table, a chair here. Quickly, you can help me.